My name is John Watson, and my specialty is physical medicine and rehabilitation. I'm a non-operative specialist in spine and sports medicine. My passion is to treat patients that have musculoskeletal disorders, figure out where their pain is coming from, diagnose it quickly, and get their pain under control as quickly as possible in order to improve their function, whether that be getting back onto the field, whether that be getting back into the job, or even being able to play with their grandkids again, without pain. One of the more challenging cases I had recently was a female patient that I saw that with severe shoulder pain that she's had for many years. Her diagnosis was well known, with a large calcium deposit within her shoulder tendon, and she's had several cortisone injections over the past several years, and nothing has given her any long-term relief. There's a new technique out there called an ultrasound-guided tenotomy that I had not performed before, and she was willing to be the first case due to the fact she didn't want surgery and had so much trouble with it over the years. But we implemented a new technology with ultrasound. We performed the procedure, and she was pain-free in about 2 to 3 weeks. The calcium deposit is gone because we were able to aspirate it out in live, real time under ultrasound guidance. And not only was it challenging, but it was certainly exciting to see the benefits that she got, and the possibilities for the future with other patients. Well, I see so many patients during the week that have so many different types of problems, whether it's shoulder pain, hip pain, knee pain, sciatica. I would certainly say that my most rewarding procedure is to do an intra-articular hip injection. I used to do those under fluoroscopy, which I still do under x-ray guidance, but now I'm able to do that under ultrasound in the office, which is quick, easy, safe. It increases accuracy and decreases the pain. Every single patient, when they come in, has pretty severe pain as they're walking, and by putting that medicine into their hip, they actually walk out pain-free. And so we know where the pain is coming from. They're excited for that, and they're very excited the fact that they're walking out without pain. And of course, that makes me happy every time I do the procedure. So that's the most rewarding. I do it so often, it's hard to pick one or two, but there's been a few that have been pretty excited about it. I'm lucky in that I can use technology for some of the procedures I do. Specifically, when I do spinal injections, I use fluoroscopic guidance, which is an x-ray, which allows me to guide the needle right down into a specific nerve. And this one nerve may be causing a significant amount of pain for someone. Maybe it's taken them into the ER, it's caused them to be off of work, it's caused them to be away from the things they enjoy, and I can use x-ray to guide a needle down to this one specific area, put medicine in which can completely eliminate their pain, or at least improve it to improve their function and get them back on, on solid ground. But I use fluoroscopy for that, not only in the spine but also into the joints. I also use electrodiagnostic medicine from a diagnostic standpoint to help determine if someone has a nerve injury, how bad it is, if it's been new, recent, chronic, and this will help also determine if they need surgery or if they can benefit with non-surgical measures. One of my passions is musculoskeletal ultrasound. It's the same technology they use in obstetrics, in prenatal care. We can now utilize ultrasound to both diagnose and intervene with injections. So for instance, if someone has shoulder pain, besides going through a bunch of physical exam techniques that allow me to try to figure out what's going on, I can actually take a probe, put it right on their shoulder, and look right in the office to determine, do they have a tear? Is it a partial thickness tear, a full thickness tear? Will they need surgery? Is it just bursitis? Is it something that they'll do very well in the short term versus the long term? Now I'm able to do that right in the office, and by looking under the ultrasound probe, I can see the tendons, the muscles, the nerves, and you can imagine there's so many different utilizations for it, from the shoulder to the hip to the knee to the hand, wrist, foot, and ankle. Obviously, being around these orthopedic surgeons that are specialists in their different areas, I'm able to target each area with ultrasound, and the applications are enormous. And so not only am I diagnosing the problem, I'm also guiding a needle down directly to where the problem is without trying to guess or messing around, which is sometimes very painful for the patient. I'm able to increase accuracy, decrease pain, all in the office setting, which is really brand new to orthopedics and musculoskeletal care. Some of the injections that I'm doing on a regular basis are intra-articular shoulders, intra-articular hips. I'm now doing calcific tendinopathy treatments. They've come up with a new procedure called PRP, which is pulling off patients' plasma and injecting it right into their tendon. You've seen high-level athletes such as A-Rod and Tiger who have had these procedures, and now we're able to bring that to Central Illinois if needed in order to help patients' pain, help them heal, help them get back to sports quicker. It's a diagnostic and therapeutic intervention that is very portable. I can take it to outside clinics. It was pretty exciting to take that to Litchfield, which was a small community that has very limited health care, and to do the first ultrasound guided injection down there felt good for me to take it into an office, which normally, we couldn't do anywhere, and I was excited to do it here in Springfield, but to take it to a small community was very rewarding. I'm also utilizing it looking at peripheral nerves, which almost no one was doing almost 3 or 4 years ago. I'm able to diagnose carpal tunnel syndrome, cubital tunnel syndrome with the ultrasound, and I can actually look at the nerve, measure it, compare it to both sides, and actually tell the surgeon where the compression is and give them some preoperative information that we didn't have before. Is there an artery around the nerve? Is there a cyst pushing on the nerve? These are all brand new things that really haven't been established in healthcare yet because it's so new. So it's very exciting, and I'm excited to bring it to Springfield.